High blood pressure, also known as hypertension. This is a pressure in the blood vessels when the heart is pumping out blood to your body. The high pressure blocks the heart from pumping. Hypertension can also be serious if it lasts long time without treatment. High blood or hypertension is not a disease. It is a condition that increased high risk to develop a disease like stroke, heart attack, heart failure, kidney disease, and any other cardiovascular diseases. If you have hypertension or high blood, then there is many things you can do at your home, and also there is many things you can do on yourself. For example, stress. There are many studies that show that stress can give high blood pressure. We have different hormones in our body, and one of these hormones is stress hormone like adrenaline and cortisol. The body normally produces a right level of a stress hormone, but when we are stressed, then it produces more hormones than the body needs. And when the level of a stress hormones is too much, it increase, it is difficult for the body to handle these stress hormones. And in this case, this is dangerous for the body. And this is also one of the reasons that our blood pressure is high, and it can give a hypertension. To prevent stress and the increased level of a stress hormone, exercise is a good prevention. Many studies show that exercise is a good prevention if you are stressed. Also recommended that 30 minutes exercise every day is good for the body. So when you feel stressed or depressed, don't lock yourself inside your room, or don't just lay on the bed. Instead, go up and go out, take a walk, take up fresh air, or go to your neighbor, meet a friend, or do something that make you feel better. Next is exercise. I already mentioned how important the exercise for our body. This give positive effect in our health, and also exercise can lower your blood pressure. Next is lose weight. Try to lose weight if you are overweight. Losing weight for just a few kilos can lower both blood pressure and the level of harmful cholesterol in your body, and also the level of your blood sugar. Also, losing weight can reduce the risk of cardiovascular disease. Another thing you can do is drink less alcohol or stop drinking alcohol. That's the best thing to do, because alcohol can affect our blood pressure, and drinking too much alcohol can give high blood. And also, we all know that drinking too much alcohol give many different negative effects to the body. Next is stop to smoke. To stop to smoke is always good. Both losing weight and stop to smoke can reduce the risk of cardiovascular diseases. Stop to smoke and stop to drink alcohol. I know these things are not easy to do, but in some way you must do it. Find something or anything that motivate you so you can stop to drink and to smoke. Maybe you do it for your own health, or maybe for your own family, or if you have a kids, for your kids, and if you have a wife, for your wife. Do it for them. Another is healthy diet. We all know that healthy diet is good in many different ways to our body. And when I say healthy diet, I think you already know what I mean. There are many studies show that a person with a high blood should eat less salt, because salt is also known as sodium chloride. And sodium chloride have different important function to the body. But too much sodium chloride can give high pressure. Can give high blood pressure. You should also know that the effect of eating less salt can be different between person to person. What I mean by this is your body can react different ways compared to someone else's body. For example, both Anna and Eileen have high blood, and Eileen eaten more salt than Anna. But Eileen's blood pressure is more stable than Anna, even though Anna eat less salt. So both Eileen and Anna, their body react in different ways when they eat salt. There's also different drugs, medication you can take for your high blood. And the choices what drugs you can take depends on your high blood status. Some have one drug medication only, and some needed a combination of another drugs to reach the target of blood pressure. For example, you take amlodipine for your high blood, and amlodipine is enough to reach the target level of your blood pressure. Another example is if amlodipine is not enough to reach the target of your blood pressure, then you need two combination drugs like amlodipine and cardisartan to reach the target of your blood pressure. Remember that before taking any drugs medication, you have to ask advice from your doctor and ask for consultant. And for the disclaimer, this video is according to what I have learned, and I am a nurse, so this is what I have learned in my nursing profession. I also advise to monitor your blood pressure. If you have blood pressure device, you can check your BP every morning and every evening. And if you don't, go to your nearest clinic and ask to check your BP at least once a week, so you know if your blood pressure is stable or not. Normal BP is around 120/80, and if you have around 135/85, that's also fine. That's also like normal. If your BP is over 140/90 and have last for some weeks or months, you may need to consult your doctor. And that's all. If you like this video, please push that like button, and please leave a comments if you have any question, and also subscribe for more videos. Thank you, and until next time. Bye-bye.